Last, let's go through totally anomalous pulmonary venous return. So here on the left side of your slide, you can see a normal heart. And on the right side of your slide, we're looking at a totally anomalous pulmonary venous return. I think this image might look confusing to you at first, so I want to walk you through what exactly is happening. The blood then comes back from the lungs through that very red-looking pulmonary vein into this superior vena cava. It's not going back to the left atrium like it's supposed to. This is totally anomalous. That blood then goes back to the right atrium, back to the right ventricle, out to the lungs again. You can see we have a problem. How's the blood going to get to the body? Well, it's going to blow through that patent foramen valley that's between the two atria. So now the blood returns, crosses into that atria, goes to the left ventricle, and out to the body. You can see why these patients are cyanotic at birth. There's a lot of mixing of blood. The right-sided blood is mixing with the left-sided blood before it goes out to the body. So in these patients, the blood can return from to a number of different places, and it can be truly remarkable. About 50% of the time, the blood is like this picture, comes back to a supracardiac location from the pulmonary system. About 20% of the time, the blood can be infracardiac, coming into the inferior vena cava. 20% of the time, the blood can come directly back into the heart, but in the wrong spot, usually the right atrium. Or it can be mixed. It can be any of the above. Sometimes the blood can even come back into the liver. So every patient with totally anomalous pulmonary venous return is going to have a slightly different cardiac physiology that has to be fully understood before surgical repair can be made. These patients will undergo a complicated surgical repair to try and get them more back to an appropriate cardiac physiology. So I'm going to close now with a trick which will help you try to remember the types of cyanotic heart disease, and it's easy if you just use your hand. So remember, there are 5 types, and I remember them like this: 1, 2, 3, 4, 5. I'll go through them one at a time. 1 is truncus, and you can see my thumb is a trunk coming off the main mixing of the right and left ventricle. Next is transposition, and you can see I've taken my 2 great vessels and I've mixed them together. Next is tricuspid atresia. Next is tetralogy of Fallot. And the last one is totally anomalous pulmonary venous return. So that's a good trick to try and remember the 5 types of cyanotic heart disease. That's very likely to show up on your test. Also, remember those 4 findings in the tetralogy of Fallot.